Okay, I think we'll get started. So firstly, ladies and gentlemen, welcome to this evening. It's a great pleasure to see you all and so many familiar faces and names, should I say. I can't see your faces, but I can see your names. And welcome to our webinar on educational pathways and professional development. The format we're going to be going with is we're going to be doing a brief presentation on, once again, the courses, the structures, and a lot of those sort of information and questions that people ask. And then at the end of it, we're going to do a Q&A session. We've had some questions submitted in advance, and I really thank those people for doing so. So we'll definitely get to those questions. But as I said, if you would like to add any questions or would like to ask a question, down the middle at the bottom, there's a Q&A box to click on, and I will then read those questions out at the end. So I would like to pass over to Campbell Elton to do our little presentation.
Thank you, Paul. So, good evening and welcome everyone. Welcome to our education Q&A session. So with the recent changes in the healthcare space, we've had a lot of doctors reaching out to us looking for education opportunities online, also looking to diversify their practice through additional services to meet the changing patient demands. At the same time, there is also many CPD requirements that have to be met. So we thought we'd deliver this session to give you a bit of an overview on the CPD activities available to you and how we can assist you with your education needs on your learning journey. So as Paul mentioned, the session will be in two parts. Firstly, I'll briefly go through a few slides with you and then we'll answer your questions. Once again, please feel free to type any questions. We really do look forward to learning about your main challenges and finding out how best we can help you. So as Paul mentioned, my name's Campbell and I'm one of the education advisors with HealthCert. So my colleagues will be joining me at the end of the slides for the Q&A session. And I guess the key takeaway from this session tonight is that we're here to help you. Our job is to help tailor a personalised approach to your professional development based on your schedules, career goals, budgets, interests, learning preferences, so on and so forth. So please get in touch with us. We'd love to have a chat. So one of the topics we often talk about with your colleagues includes CPD requirements. And we can help map out a plan for that. So this would include talking about any prior courses you've completed that may qualify for recognition of prior learning into one of our programs, which you might not be aware of. Also, we discuss your learning preferences. We like to see, where you work, whether in a general practice, doing a bit of everything, or if you are focusing on a specific area of medicine, like a skin cancer doctor, for example. We'll discuss payment plans, postgraduate studies, and much more. So if you ever feel a bit stuck when planning your CPD activities, please feel welcome to give us a call. Some of you may have completed a course with us previously, and I'll briefly review some of the key HealthCert education points of difference. So we are Australia's only university certified medical education provider. That means upon completion of any course, you will receive a certificate with university acknowledgement. Now, our face-to-face, our programs can be delivered online and face-to-face, and they cater for everyone from the beginner to the intermediate to advanced learners. This means you can either acquire the foundation skills in a particular field and move on, or stay with us and complete your professional diploma, and then maybe continue your postgraduate studies through one of our university partners. So here's a slide showing all of the professional development pathways. So certificate courses and professional diplomas are available in all these fields. And I'm excited to share the two newest additions, medicinal cannabis and women's health. They'll be available in the second part of this year, and they'll both be delivered entirely online. So entry requirements and RPL. So in terms of entry requirements, all courses are suitable for doctors, international medical graduates, and some courses are available for nurses, dermal therapists, and other degree qualified medical professionals. You can see the study pathway is simple. To qualify for a professional diploma, you need to complete 3 certificate courses. It's important to note that RPL is available for all of the pathways and courses. So choosing your courses. As there are many courses and topics, we usually work out with you what your interests are, what your expertise is. If you prefer to learn face-to-face, if you prefer online learning, based on all of that, we can make a tailored recommendation for you that meets your needs. Now, this is a wonderful slide. The slide is a little bit complex on the surface, but I really wanted to share it with you because it shows how the different education pathways complement each other, give you all the options to extend your skill set. So what I mean by that, we have a lot of doctors who have upskilled and started practicing in skin cancer medicine, for example, then start seeing patients who also ask about other general dermatological conditions or about cosmetic services. So these courses can be completed to extend the existing skin cancer skill set. Also, we see aesthetic doctors who find it beneficial to upskill in medical nutrition, as that service fits in very nicely with the cosmetic patients that they see. They're just a couple of examples. Also, if you decide to continue your studies to a postgraduate degree, that is also possible, and you'll receive academic credit from your HealthCert studies towards various universities. If you're looking for some practical application of your skills, we can help organise clinical attachments at participating clinics. So as you can see from that slide, there are many possibilities. Okay, so course delivery. Here are a couple of points on course delivery. So in line with our affiliation with universities, we do follow strict educational standards. All the courses include online pre- and post-course activities consisting of reading and writing assignments and exams. The good news is everything is completed online. Now, it makes sense to complete the exams within 3 months of attending either the face-to-face course or completing the online modules. This not only ensures the content is fresh in your mind, but it's also an important learning tool. So the delivery mode. So face-to-face delivery. Some of the courses include a practical 1 or 2 day workshop, for example, the skin cancer surgery or aesthetic medicine courses. As you can see in the pictures here, you'll get to practice the various procedures on pork parts and simulated models. The face-to-face education events are incredibly popular. And the other great thing is it's a fantastic opportunity to network with your colleagues. Now, we have the next face-to-face education event coming up in Sydney in September. Obviously, we'll be monitoring the current situation and delivery format of the course to align with the government recommendations to ensure the safety of all attendees. Online delivery. Very popular at the moment for obvious reasons. The online courses are delivered via pre-recorded video lectures, live and recorded webinars, and forum discussions. Now, the key thing is you can study at your own pace. There are no fixed times that you have to be online. You can watch the video lectures and complete the exams at your convenience. Now, one of the questions that I'm often asked, or some of the doctors who participate, they do like to work to a time frame. So we have provided a suggested framework for those participants who like to work to a schedule. And this allows you to complete everything within 3 to 4 months. Now, typically, doctors I speak with who would work full time would devote 1 evening per week over that duration. Online learning, it's a great way to get a university certificate without the out of office or weekend time constraints. So the online learning is delivered through our e-learning platform. All the course content and activities can be found on the e-learning platform with your personal login. An important feature is that even after your course completion, you still are able to log in and review and replay all the course content. And that's a really great feature. So here is a snapshot of the e-learning course page. So this is where all the content lives. Also, to support your post-course learning, we also run regular alumni webinars and case discussions where you can ask presenters questions if you encounter challenges with the implementation of your skills. So when you register for your online course, as soon as you register, you immediately given access to the e-learning page where all the materials are. So, exams and assessments, always questions come up about this. So a couple of key points regarding the exams. They are completed online, and as I mentioned earlier, we recommend that you complete them within 3 months of attending the face-to-face course or completion of the online content. The great news is you don't need to complete the exams in one sitting. What I mean by that is you can log on and log off, and you can sit them as many times as required to achieve the pass mark. Extensions are available, of course. We do understand that you have many competing priorities. All of the courses are accredited as CPD activities. Some of the courses qualify for the Rural Procedural Training Grant, and there is also international accreditation with partnering institutions. So on completion of all of the post-course activities and requirements, and in recognition of your skills, you will receive a certificate with university recognition and college accreditation. Now, the certificate itself is a valuable and important way of building your professional credibility, and patients really do value that highly. As mentioned, you have the option to continue your studies towards a university degree and/or postgraduate certificate with one of our partners. Now, we can also organise a placement at one of the European universities where you can observe and work with leading experts like Professor Harold Kittler in Vienna, for example. Now, just a couple more slides before we get to your questions. I'd like to invite everyone who has completed a course with us to join our new alumni platform. This is an exciting innovation. In there, you'll find lots of great things, including special invitations and all of your course content in one place. Now, I'll keep this slide up for a moment. You're welcome to take a screenshot. Lots of ways to get in touch with us. Now, I realize there was a lot of information and it was of quite a general nature. And it was really designed to provide a quick overview of what's possible in terms of your professional development. I really do encourage you to schedule a 15-minute chat with us where we can provide more detailed and personalised advice and recommendations for you regarding CPD points, RPL, study options, so on and so forth. We are here to help. So now I'd like to open the floor to your questions, and I'll do that by handing back to Paul and inviting my colleagues to join us.
Awesome.
Over to you, Paul.
Thank you, Campbell, and once again, thank you for your presentation. Just a quick reminder, once again, for everybody, if you would like to ask any questions, and I think obviously probably in a more general nature, we have got some specific ones, and I'm just conscious everyone's individual situations a little bit different, but there's a Q&A box at the bottom if you'd like to put any particular questions in. What I might do is there's probably about 6 or 7 questions that were CPD related, which I'll probably defer to Hamish. So I think the key thing, Hamish, was some of the questions was around how to acquire and accumulate points. So I suppose the question would be, when are the points given, or what is the process you would have to go through to be able to get your CPD points?
So our courses are accredited by the RACGP and ACRM in Australia. And as Campbell mentioned, when you've completed the post-course requirements, including the assessment, at the same time as the certificate is issued, we upload the points if you're a member of the college of the RACGP or of ACRM. So there was a delay earlier this year, as this is a new triennium, and there was a delay and a backlog in the RACGP getting their systems ready. Fortunately, that has now been cleared, and for all of the doctors who completed courses already in this year, the points will now have been uploaded or being uploaded as we speak. But generally, it happens at the same time as you receive your certificate.
Okay, awesome. And obviously, I've said, how do you obtain CPD points for New Zealand? And I've got a similar question for England. So just how does that process work?
Yeah, fortunately, the RACGP is very well recognised globally, particularly in Commonwealth countries. And so the Royal Colleges in each country generally have reciprocal recognition. So specifically, we have written confirmation from New Zealand and from Hong Kong and from Canada that should you complete a HealthCert course and receive the RACGP accredited certificate, you can submit that to your own college in New Zealand or in Hong Kong or in Canada, or in fact, I'm pretty sure most colleges, the RGCP in the UK also, or the RCGP, will also recognise it. So you will need to take the HealthCert certificate, submit that. There should be a information on your college website and be able to upload those points. Generally, the recognition may be different. In Australia, we have a point system which does not necessarily allocate directly to hours. Many of the other colleges have a strict hour system where if you do 6 hours of learning, you get 6 hours recognition. If you do need that translation, if you do need to know, and we often provide letters confirming the details to support your claim for points with your appropriate college. We're certainly continuing to try and identify other colleges that we can get advanced recognition with. And so if you do have a particular request, please let us know and we can reach out to that college to confirm the recognition.
Excellent. Probably a question for Campbell. With relation to master's programs, because the courses, once you complete the courses, get credit into master's programs, what typically is the process to get the credit into those master's programs?
Yep. So specifically, if we're talking about the Masters of Medicine Skin Cancer at the University of Queensland, that's a very popular program that our alumni would move on to. Two of our pathways provide specific direct credit into that program, so no further work is required. So that's our Professional Diploma of Dermoscopy and the Professional Diploma of Skin Cancer Medicine. They'll provide direct credit into the Masters of Skin Cancer Medicine. You simply need to provide evidence that you've received the certificates from us with your application when you do that. And that will typically be the case for any of the postgraduate studies that you'll do with any universities. As part of your application, you'll include our certificates.
Awesome. Loretta, one question for you. So how long does it take to do an online course? I mean, if I suppose, does it take...
So the courses are designed to be completed within 15 weeks. However, we have a flexible structure with the courses so that basically when you enrol and pay for the course, you receive instant access to the online course material. And you're able to just follow it at your own pace and within your own schedule. So if you need to take, 6 months to complete it, that's fine with us because exam extensions are readily available.
Wonderful. But I suppose conversely, if you want to do it quicker than 15 weeks and you're prepared to do the work, you can do so, particularly with some of us that are locked up at home and have a little bit more spare time.
Yes, and that has been the case in the last few months. Doctors have taken that opportunity to complete it in less than 15 weeks.
Yeah, awesome. So there's a couple of questions around, I suppose, face-to-face events going forward, and I might try and answer this because obviously we're living in an uncertain world. I think we all understand that. We did have an event scheduled on the Gold Coast in June and took a decision a couple of months ago to not run that particular event. Thankfully, the other two events we've got are Sydney in September and Brisbane in November. So from what we're doing there, as I said, is we're obviously practicing all the social distancing. We've made sure the layout of the rooms that, you know, we qualify for that. Obviously, when it comes to looking to cater for people, still meet, once again, those minimum requirements. So at this point in time, as far as being, you know, safe environment, complying with the regulations, we've done all of that work. And that's because we've had to shift everyone from the Gold Coast into either Sydney or Brisbane. It's obviously now meant that Sydney and Brisbane are a lot more full than what they would normally be. So I suppose the number one, as far as a safe environment, obviously it's going to be with your peers and colleagues in that, and obviously not everyone's going to be sitting next to each other. You're all going to have a little bit more space in between one another this time and for the foreseeable short term whilst we're obviously living in these particular environments. And one of the other questions was around, well, what if something was cancelled? I mean, ultimately what we would do is give you the option to, you know, just roll into the next course, you know, if you'd like to obviously go to the next course, or you could get a refund. So there's no risk as far as making a decision as to whether you want to do a face-to-face event if the government was to change the rules on us. And as we know, every state has slightly different rules at the moment, but we would suggest that by September we should be very safe for that to occur. I think the other questions, so I've got a couple of other questions here I could look at answering. There was some things around, like, you know, having a gap. So I did the education 3 years ago. You know, do I have to do these things sort of relatively quickly, or can I do a course? And then obviously, well, in this case, this question was around 3 years before they came back. Owen, do you want to have a go at that?
Yeah, look, absolutely, Paul. And I mean, very much as Campbell mentioned, what it comes down to is personal preference. Obviously, we want to tailor the education to what is going to be most relevant for yourself. So look, as stated, you can still log in and access your materials from those courses, even if it was 3 years ago. Certainly, I might suggest starting there. And then at that point, if you decided you would like a refresher, that's certainly something we can have a look at doing for you. But if you did feel that the more advanced course is what you were ready for, then of course that would be what we would go for too.
Yeah, I mean, it's a good point. For a lot of doctors, it is get the knowledge, then apply it in your clinical practice before you're ready to get the next, you know, piece of that knowledge tree. So some people that can happen very quickly, depending on their caseload. Others obviously can take longer. So there is no specific time. I suppose once again, it is self-generated based on your experience with relation to that. And I've got another question here, which I probably will give it a go because it's a little bit challenging. So a pathway to becoming obviously qualified dermatologist or getting into the dermatology pathway by doing, let's say, the diploma in general dermatology. I mean, it's definitely not a prerequisite. I mean, what we find is that for doctors that are interested to get into the dermatology program, but definitely doing professional development in that space does obviously look good on your resume as you're going through that process. So we do actually have a lot of doctors who are interested in, you know, those sorts of programs. To sort of use this as, once again, as an ability to upskill, but secondarily, well, I suppose, demonstrate obviously their commitment or, you know, passion, I suppose, for the subject as one of the methods of getting through to that. Sorry, just quickly, so I'm skim reading questions and I've got a few, so let me go to the ones that have just been asked live. So for a non-physician, is there still any benefit from the CPD points? Campbell?
Well, it all depends. The CPD points themselves are generally required by a specific body, registering bodies, like the RACGP, for example. So part of their membership is that you are doing continuing professional development. So I guess the question would depend on if you need to demonstrate continuing professional development, then yes, those CPD points are of value to you. I hope that answers the question.
Yeah, I mean, like I said, it's typically CPD is requirement to keep your registration or whatever the, you know, rules are in the different places you are. So if you're not somebody that has it as a prerequisite, but it's also one of the questions we get with registrars or with other people that are not yet qualified doctors around that sort of stuff. It is obviously a requirement typically for forms of registration depending on which part of the world you are. And that's how that basically is applied. Now, I've got a couple of very specific questions that are a little bit challenging. And what I'm going to do is actually going to email those doctors directly because I think that the particular situation, and some of it is we need to clarify the question. So I've got a couple of questions here which, to be honest, I don't have enough information to be able to make it a question that we could really understand. So if there's no other specific questions I've got, the only other one, sorry, I've got that can be answered is, it's a doctor from England, so probably would like to know the answer. How can we presume that surgical face-to-face workshops can't be done virtually? So I suppose up until now, some of the courses that we've had have only been available face-to-face. If you want to do surgical training, you have to fly to Australia and turn up to here. Hamish, do you want to maybe explain that, Doctor, for the UK around that?
Yeah, well, we are actually working very hard to develop versions of the surgical courses that are available online. And the key difference, or the important thing to remember is that with the surgical courses, primarily we're teaching planning, layout, and techniques that you can learn from watching. Clearly in the practical, you get the opportunity to practice suturing and to refresh. But degree qualified doctors have learned suturing at university and should already have that skill. But what you need to get from more advanced is how to position an excision on the face or on the body for optimum scar repair, and to ensure that you remove all of the cancerous tissue. And so all of those courses are being modified to focus on the planning and to provide some interactive sessions where there is live tutorials with the participants via a Zoom webinar like this, where they'll be interacting with visual models and with 3D interactive software, so that you can actually look at if there was a lesion on the face, how you might position that and how you might excise that. And so they're really advanced planning techniques that don't necessarily require observation of your skill. Particularly also, since this is professional development education, we're not actually assessing competence. And so at the end of the day, whilst you're doing this education and we're teaching you and showing, you're learning the materials by watching it, before you can practice on a patient, you will still need to go through an appropriate mentorship or other to ensure that you can practice safely and also with your insurance.
Okay. No, thanks for that, Hamish. A couple of other questions that I've got here that I'll tackle. Any courses planned for Perth this year? I understand it's like, and so in the comment is, it's like flying overseas from WA to other states. I think at this point in time, the challenge is we're probably not allowed into the state. So I'm only saying that as a bit of a joke. It's a topical situation. The answer is not at this point in time. We may consider to do that last year. We did do an event there late November last year. But obviously appreciate, yes, it's not always easy, but obviously that's conversely for doctors from Darwin or other parts of the country for it. The advantage, of course, though, is if you actually want to do any of the programs, you can actually do them online. So there's also the option of doing the course online. Then if you would like to then come and do the face-to-face one, you are able to do that as an option as a top-up. So for some people, it might be get access to the knowledge now, so they can obviously access it today, knowing that there's a face-to-face event in months ahead. There is the opportunity to be able to access the content now and then look to do the face-to-face or come along and attend a face-to-face practical workshop if you wanted to. So some people will get enough knowledge from one method, and everyone learns differently, as we know. Some people, online works beautifully. Some people want to sit in a room for 2 days and have the intensive. So the whole idea is, depending on you, as Campbell mentioned in the presentation, it's really around how you like to learn and try and meet that need. Another question for a doctor in Canada. So do we have any clinical attachment programs in Toronto? Hamish?
Well, I was just going to suggest, we don't specifically, but we do have a good relationship with the Primary Care Dermatology Society of Canada. We've run courses in conjunction with them, and they have some very good dermoscopists across Canada who we've worked with both in our education and have attended our courses. So we would be able to find out from the society if they have doctors who are qualified in or have done or use dermoscopy often, and would be interested in having someone attend and learn more. So please contact the team. I think, Campbell, it is info@healthcert.com with the request, and we can pass it on to the Primary Care Dermatology Society of Canada to see how they might be able to assist, that would be the best way that we might be able to find someone.
Cool, excellent. Two more. Is there a discount for buying a pathway? So you talked about before, there's 3 steps to the pathway. Owen?
Yep, definitely. So short answer, yes, absolutely. So as was previously mentioned, there's 3 courses within each pathway. You are, of course, welcome to enrol in programs individually, certainly whatever suits your needs and timeframes best. But on the flip side, we do, of course, offer a discount if you initially bundle 2 or 3 courses together. And that can be either upfront or by deferred payment as well.
Yeah, that's a fairly good point. So yeah, once again, the commitment, you can actually enroll for courses and once again have them paid off in a process of months, so as you're upskilling and using those skills within your practice. And ultimately, once again, the programs are designed so you can subspecialize in a subject or have a base level of knowledge across multiple subjects. It's completely up to you. But we're seeing increasingly doctors obviously interested in subspecializing in certain areas of medicine, and we're pretty much the only methodology by being able to get a professional diploma in certain subjects. And obviously we're excited about having medicinal cannabis and women's health later this year. And this is the final question. So how to schedule a call, or what's, everyone's time poor. I mean, everyone here and everyone on this call. So Campbell, what's the best way as far as trying to, and specific situations and all these sorts of things?
Yep, definitely. The easiest thing is to shoot us an email, info@healthcert.com. And simply just give us some times that would work for you. Just say, hi, HealthCert, I request a call back to discuss X, Y, and Z. Best availability is Wednesday at 7 p.m. or Thursday at 9:30 a.m. And we'll respond to you via email and schedule that call. Or hop on the live chat. You'll be talking to myself or Loretta or Owen or Richard on the live chat in between. When you have a chance, once again, ask someone to schedule a call.
Yeah, that's great. I mean, I think the key thing is that it's not as simple as it's just, buying a roll of toilet paper, not using that as the example, but the point is that because everyone's situation is completely different, you may have done courses elsewhere or have specific things. There is actually quite a lot of detail in it. So definitely scheduling a time when you've got the time to have the conversation is definitely a great use, because it is your future and your professional development. So we're very keen to do that. So I think that if you do want to make that time, we'll schedule it and put it in your appointment book like everything else that probably goes on in your life, except for maybe sometimes on the weekend. And I've had a couple of very specific questions. One's around getting post-diploma fellowship from the general dermatology. We'll answer that one directly because I'm not sure which fellowship pathway you're referring to. So as I said, there were a few questions I got asked that we'd have to dig a little bit deeper and probably too much specifically, which is actually an individual question for this particular forum. Okay, so ladies and gentlemen, I'd like to thank you very much for your time. I'd like to thank the team for their time and just let you know that we're here to help. So anything we can do, please reach out. And hopefully we look forward to either seeing you face to face, as many of you are familiar friends, or we look forward to seeing you online. But thanks very much for your time tonight. Have a great evening.